Do you frequently feel like your heart aches sometimes? Or maybe your fingers tingle when you're not doing anything? While these might seem like small things, they could be clues that your body is reacting to something. Imagine your blood is like a team of workers that fix cuts and stop bleeding. One group of these workers are called platelets. Sometimes your body makes too many platelets because it's responding to something else, like an infection or injury. This over-response is called reactive thrombocytosis. Think of it like having 20 security guards at a small shop, way more than needed, because someone once saw a suspicious shadow. It's not the platelets' fault, they're just overreacting to a signal. But too many can accidentally block small roads, blood vessels, or make your blood too thick. So why does the body suddenly, say, make more platelets now? It's usually not because the platelets are damaged. Instead, it's due to another problem talking to your bone, marrow, the factory that makes blood cells. Common causes include infections like pneumonia or a bad tooth abscess, ongoing inflammation, such as arthritis recovery from surgery or bleeding, or even iron deficiency anemia. Picture this: you cut your finger cooking dinner. Your body says we might need more platelets just in case. But sometimes, even after the cut heals, the signal stays on because of hidden inflammation or low iron. Other triggers include recent childbirth vaccination or chronic diseases like inflammatory bowel disease. Importantly, it's a reaction, not a disease of the platelets themselves. Here's a real-life moment. Have you ever had a fever for days, and then your doctor finds your platelet count is sky high? That's a clue. Most people with reactive thrombocytosis don't feel anything special, but some might feel warm hands and feet, head throbbing, blurry vision, or even nosebleeds. Think of Lisa, a 35-year-old teacher. She felt tired and had joint pain for weeks. Her blood test showed sky-high platelets. But the real cause, rheumatoid arthritis. Once treated, her platelets dropped. Others may feel dizzy or notice easy bruising. The symptoms aren't from the platelets themselves, but from the root cause, like infection or inflammation, talking to the platelet factory. How do doctors figure this out? First, they ask, are you recovering from surgery, any fever or pain? Then comes the blood test, a complete blood count, CBC. If platelets are over 450,000 per microliter, they dig deeper. They look at other signs. Is CRP, a marker for inflammation, high? Is iron low? They LL check your blood smear under a microscope. Let us see if platelets look normal or weird. If they look normal and you have an infection, it is likely reactive. But if platelets are abnormal, they might test for rare blood cancers. Treatment: focus on the real problem, treat the infection, fix iron deficiency, manage arthritis. You don't treat the platelets directly, just like you wouldn't fire extra security guards if the alarm was fake. Most people don't need blood thinners. The platelet count drops naturally when the root cause is fixed. Can you prevent it? Not exactly, because it's a reaction, not a standalone illness. But you can reduce risks. Think of it like wearing a helmet while biking. You're not stopping accidents, but lowering damage. Stay up to date on vaccines to avoid infections. Treat infections early. Don't ignore that persistent cough or gum swelling. If you're tired all the time, get checked for iron levels. Women with heavy periods should talk to doctors. Low iron can trigger this. Eat iron-rich foods, like spinach and beans, and manage chronic conditions like Crohn's disease or lupus. Early care means your body won't have to overwork its platelet factory. Scientists are now digging deeper into how inflammation talks to bone marrow. Recent studies show that a protein called IL-6 interleukin-6 acts like a megaphone, yelling at the body to make more platelets during inflammation. New drugs blocking IL-6 are being tested not to treat reactive thrombocytosis directly, but to calm overactive immune responses in diseases like arthritis, which in turn helps normalize platelets. Also, better blood tests now can quickly tell the difference between reactive thrombocytosis and rare blood disorders like essential thrombocythemia. This means fewer unnecessary treatments. In 2023, a study found that using AI to review blood smear images helps detect early changes, like having a smart assistant peek at the